Hello, my name is Dr. Corey Richardson. I'm the CEO and Clinical Director of ICGH Treatment Centers. At ICGH Treatment Centers, our mission is to provide accessible and comprehensive behavioral health services to individuals and families across multiple North Carolina counties. We are committed to delivering evidence-based treatments with an integrated approach. Through our counseling, medication management, recovery housing programs, peer support services, medication-assisted treatment, accredited provider trainings, inpatient services, pharmacy services, and prevention initiatives, we strive to empower individuals on their journey to recovery. By collaborating with various agencies and securing grant funding, we actively contribute to improving communities in North Carolina. We are dedicated to ensuring high quality care, fostering partnerships, and embracing innovative strategies to address worsening societal problems, such as the low quality of behavioral health care, the opioid crisis, the increasing numbers of unsheltered persons, and childhood trauma. With our telehealth and in-person services, free services as well as insurance acceptance, and a commitment to confidentiality, we aim to make our services accessible to all. At ICGH Treatment Centers, we stand as a beacon of hope, guiding individuals and families toward lasting recovery and promoting overall well-being of our community. It is our goal for persons struggling with behavioral problems in their families, such as substance use disorders, depression, anxiety, or PTSD, to understand that these are treatable medical conditions and that there is a path back to meaningful lives with the tools we provide in our prevention and treatment programs. This is the most effective way provided via evidence-based medical, pharmacy, toxicology, and behavioral health and social interventions, which we offer to both insured and uninsured individuals of the communities we serve. Here's a brief overview of the services we provide to adults: comprehensive clinical assessments, individual and family counseling, outpatient services, EMDR. It goes on. Intensive outpatient, comprehensive outpatient, recovery housing, Suboxone clinic, 5 days a week, referrals into our inpatient treatment facility, as well as training programs, as well as counseling, drug education, free peer support, and physical medicine as a bridge into any of the other services. We also provide child and adolescent treatment around anxiety, depression, cognitive disorder, as well as other types of disorders like complex trauma. More services that we provide specifically for those disorders include trauma-focused CBT, comprehensive clinical assessment, prevention screening, in-school and community prevention services, individual and family counseling, and then there are those who need substance use disorder therapy. We are very proud of our trauma-focused CBT program with our roster providers, providing therapy for children as young as 3 years old for complex trauma, including sexual abuse. Trauma-focused CBT is extremely needed in North Carolina. Some of the criteria include children as young as 3 to 18, as long as they can remember the actual traumatic incident and be able to verbalize it. If they are living with a guardian or a family member that is not the offender. We can also offer trauma-focused CBT through telehealth if the child is old enough to focus on the screen. It is very important for family participation, and we have seen that really good outcomes with just family participation has improved the outcomes of these children. And very often when children are hard to place in foster care systems because of what is considered behavioral, it's actually untreated trauma. So this is an excellent program that we do offer in the counties that we serve. When it comes to substance use disorder, we do follow a recovery-oriented model. We often will employ persons with lived experience, such as counselors and peer support specialists, as well as therapists and our medical providers. We use a modified 12-step facilitation program that really leans in heavily to the recovery community and those evidence-based drug-free coping skills so that when treatment is over, recovery can continue. we do incorporate other types of evidence-based models of care, such as EMDR, CBT, and motivational interviewing. Briefly, there are a few things that set integrated care apart. ICGH only offers small groups so that persons can get the attention in a group setting that they need, as well as flexible counseling schedules for individuals and for evenings and weekends. We have a very close interaction between all of our staff. That's an interdisciplinary program that allows our doctors and counselors and therapists and pharmacists and all to work closely together to improve treatment outcomes. And all of our programs are whether insured by insurance or county, state, and federal funding for those who are uninsured, and extra funding that's available through federal and state funds for housing and medication. As I mentioned earlier, we have attracted and retained a lot of providers who have what we call lived experience, either personal experience or close familial experience with addiction or mental health problems and are in recovery, long-term recovery. And that allows us, I think, to really meet the patient where they are, a higher level of therapeutic alliance, and really able to engage them motivationally. We accept Medicare, Medicaid, TRICARE, private insurance, and then, as I said earlier, we have a lot of federal and state funded programs. We have a number of different behavioral health clinicians, social workers, addiction specialists, certified counselors, licensed mental health counselors, and peer support specialists. There are a number of different types of providers on our medical team, from physicians, nurse practitioners, and PAs. ICGH provides medication management for behavioral health needs such as anxiety, depression, and trauma, which really has proven to be effective along with counseling, as well as medication-assisted treatments like Suboxone, Sublocade, and Vivitrol. We provide these medical services 5 days a week. We employ licensed pharmacists for our clinic-based pharmacies and essential retail pharmacy. We provide low-cost medications, free medications, and federally funded medications. We provide easy confidential pickup at our offices. And we also provide delivery of medication to our partner clinics across North Carolina. I have referenced our grant funding and state funded programs, and see these are some of those funded services that we provide across North Carolina: peer support, accredited provider education, free Suboxone and other types of medications for opiate use disorder and alcohol use disorder, recovery housing, transportation for recovery focused appointments, referral services, community interventions, as well as free counseling for substance use disorder. Just a quick overview of some of the services we've been able to provide through the federal grant activities. Free treatment for those requiring medication-assisted treatment with counseling and peer support, outreach supplies to the unsheltered persons in our encampments and in our shelters, free transitional housing for those in our treatment programs, anti-stigma TV and billboard campaigns, funding for prevention initiatives in school, lock boxes, Rescue Narcan, Deterra medication bags for destruction medications, as well as permanent lock boxes in multiple counties, peer support inside of local agencies such as DSS, shelters, and EDs, awareness events such as international overdose awareness and other types of education and awareness activities, and then educational opportunities such as our provider education, our Bridge MAT presentations, OD mapping, and etc. Routinely, you'll see news releases such as this, where there's a multi-million-dollar grant that has been awarded to ICGH treatment centers for the services that we provide. We are very proud of the quality of care that we deliver, not just of treatment services, but also around community interventions. And that's why we have been consistently able to receive multiple multi-million-dollar grants to serve North Carolina. Prior to a lot of hospitals offering a pregnancy program around opioid use disorder, Some of our very first referrals into our program were from local hospitals across North Carolina for women that were pregnant. We were guided by the UNC Mother Study, and we knew that the work that we were doing was evidence-based in providing the care that we did. And subsequent to a lot of the programs that we started in North Carolina, we now see hospitals across North Carolina also providing that. Um, our own program did receive one of our admissions was a nurse who was pregnant. Now that nurse, after having delivered a child in our program, helps other women through this process as well as a volunteer. So part of our pregnancy support services is we do obviously expedite induction of pregnant patients into the program. We provide psychoeducation, offered in compassionate and supportive manner to prepare mothers about the process. And due to the group-based nature of our counseling, we do place pregnant women in gender-specific programs of counseling so that they can get the support from other women who've gone through the same process. And as I mentioned, a nurse in recovery who delivered her child with us also helps persons in our program. And this is a nice Venn diagram that I presented, that I also created for the opioid panel from Roy Cooper in 2018. The biopsychosocial spiritual model. It is whether it's an opioid use disorder or a mental health disorder, uh, and any medical condition, there are different dynamics of that condition. And if your treatment planning and your interventions do not really incorporate all those different dimensions, you're not going to get the same outcomes. And we have a real strong emphasis on the principles and features of treatment planning, which include stigma-free, strength-based, person-centered, as well as working with an interdisciplinary team with a shared treatment goal, shared treatment planning, shared diagnosis, and really looking at a shared assessment with shared outcomes. And that's what integrated care really is all about. We have been doing this work for a very long time, and that incorporates our educational programs through Northwest AHEC at Wake Forest School of Medicine. It means community outreach across North Carolina. It means working with our legislature, our governor, our lawmakers. Very proud of the work that we've done in that regard to inform those who make the laws and then fund the programs. We have for a very long time worked on a real community level around outreach to address stigma and offer education. So you might see us at Oktoberfest or at Apple Festival or other types of festivals. We work closely with our faith-based communities. We try to really have a lot of presence in media to address some of the stigma and misinformation that's out there, and very proud of the research that we have done with the North Carolina Physicians Health Program. Because if you're not really looking at research, how can you improve the delivery of care? So we were the agency that provided the first ever primary research around providers and monitoring coming out of North Carolina. We not only offer events around awareness throughout the communities, we also hold very large summits, such as the one we just recently held in Gastonia, Recovery Summit. Similarly, large summits around awareness, connecting people with national speakers, with their lawmakers, and then really strong evidence-based programs to help providers as well. I'm very proud of our recovery housing program. It's been around almost 10 years. We were the first in this region that were able to offer recovery housing for free to those that were on medication assisted treatment when other housing programs shied away from that. And that really was the impetus to start our program. And now we have over 80 beds across 6 counties of recovery housing for those in our treatment programs, all federally or state funded. Here's a sample of some of our anti-stigma billboards that really led to some of the messaging on our outreach bags to the unsheltered. And as you look at this billboard, you'll see that not only are we informing the community about the free care available at ICGH, We're also informing people that there's connections to other providers in the community. And so we really have tried to not just promote our own programs, but really work with others who have high quality programs and try to shift some of those seeking help away from those predatory providers that sometimes don't really make the situation any better. Those outreach bags that I just showed you with the anti-stigma messaging and our contact information include a lot of supplies such as toilet paper, menstruation products, socks, underwear, gloves, hats, sunblock, cooling towels, rain jackets, information that around free care, rescue Narcan. But really, when we're going out to the encampments, we're really trying to engage people where they are. From our peer supports have lived experience themselves about not only addiction and mental health, and now being in recovery, but they also have experience around being unsheltered and unhoused. And so, connecting with people that are unsheltered and trying to communicate with them, there's hope, and trying to bring them into our recovery housing where they can get counseling and medications. This is an image that was on Charlotte Today when our program was featured on Charlotte Today, a great morning program um, about how we are working with North Carolina communities to address the challenge around the unsheltered population. And most of the people that we find out there overwhelmingly have a substance use disorder and or a mental health problem. So working with the peer supports to engage them and then bring them into recovery housing, um, or other type of housing, just our housing programs, and then connecting them with a provider that can help them with physical medicine, including hepatitis C treatment, as well as behavioral health services. Our federal and state programs fund community-specific harm reduction, such as lock boxes for medication, pill take back programs, drop boxes, deterra bags. That incorporates also Rescue Narcan, the Safe to Call media um, promotions, those other initiatives around harm reduction, testing strips, etc. So really, when we work with harm reduction, it's a way to engage people and really open the door to treatment and long-term recovery. And it's really a community-specific program. We're not trying to do something that's not really welcomed by the community, but we are bringing federal and state dollars that are absolutely needed. We are extremely proud of our growing mobile program. Our ICGH mobile services include a recovery bus that we can bring to the encampment so people can come in from the weather, talk to a peer support specialist, have coffee, get some outreach supply bags, and really talk about the availability of housing and treatment services for free. And now with Medicaid expansion, really working to enroll persons that really need the insurance to get the help that they have. And then we also provide direct medical services from some of our vehicles. It means connecting with a PA or a doctor. That means drug testing, hepatitis B and HIV screening and testing, as well as treatment. So really proud of this growing program for mobile services, particularly in our rural communities. You might have seen some of our PSA TV ads to really address the stigma of addiction. So many people consider it hopeless around mental health and addiction, but really many of us live very happy lives after getting the right types of interventions that lead to long-term recovery. Our federal programs fund provider education around best practices. These are AMA accredited, American Medical Society accredited for physicians and PAs, as well as North Carolina Board of Nursing accredited programs so they can get continuing education around best practices. The program is not just for treatment services. We have supported and developed programs for communities, not just in North Carolina, but also nationally. Medication assisted meetings. These are 12-step meetings for those who are on MAT services. And these offer really traditional fundamental 12-step programs where people can discuss higher power, they can look at personal inventory, and really work the steps, whether they are in treatment services or not, with ICGH, and whether they started their journey on medication or not, a stigma-free environment. Here is just a little about me, the clinical director and the CEO, some of the work that I've done. And this, of course, is our medical director, Dr. Chris Sharaj, and his work in North Carolina. We are extremely proud of our inpatient facility opening in Carteret County at sea level, North Carolina. Facility-based crisis, regional detoxification services, inpatient residential for substance use disorder. We will have our outpatient services there as well, and also it's a community recovery hub, involuntary commitment, and another service that's truly needed is inpatient adolescent behavioral health. This is a 110 bed facility inpatient, as well as the outpatient clinic and other services. This facility is Carolina Wellness Centers at sea level. So just to tie it up a little bit, in conclusion, ICGH focuses on a person-centered program related to recovery instead of just rigid service-focused programs that neglect participation in the recovery community, whether it's addiction or mental health. Our counseling, medical, nursing, and administrative staff do have personal experience and close contacts with the disease of addiction as well as mental health and are now in long-term recovery. So that's what we refer to as lived experience. And really applying this experiential knowledge along with their clinical skills has really made our program extremely successful. We are equipped to serve the uninsured, those who have Medicare and Medicaid, as well as private insurance at all levels of care. And we have a lot of diversity in our trained staff. That means clinically, as well as just our backgrounds. This is our family of companies that we're very proud of. It incorporates BUP Online, which is a statewide low barrier program for medication assisted treatment like Suboxone. Includes our nonprofit Recovery NC, medication assisted meetings that you can find online, recovery housing, our pharmacy program. Just very proud of all the work that we've been able to do at ICGH. But finally, this is our contact information. We have one phone number across North Carolina, 828-322-5915. We do have 24-hour coverage if anybody needs help. But during the regular office hours, you can call there and get help. At our website, integratedcarehickory.com, we have online intake packets for anybody seeking help, whether it's substance use disorder, adult mental health, or child and adolescent health. You also have online referrals, so you can go to the website, pull the online referral. It takes about 1 minute, and then you can upload a release of information if you are a referring agency, so we can reach out to you and about that referral itself. And really, there's a lot of other great information if you go to our website. And I hope you follow us on Facebook or other social media. Really proud of the work we do, and we try to keep Facebook up to date on all that work that we're doing in North Carolina. So thank you for your time today, and look forward to partnering with you individually or as a referring agency.